Well, thanks so much for having me back. I was thinking about it on the way here. It's been more than a year since I've been in Wisconsin, but we've been doing work here for about 2 years. So what I want to do today is, for those of you who are new to our organization, I want to introduce you to who we are, and also talk about what we've been up to since the last time we were here. So there will be 3 sections of this presentation. First, since data is in my job title, I can't help but talk about it. So I'm going to present the new, most recent and current data we have on the workforce in Wisconsin. So this is especially for you guys. It's not yet on our website, but it will be soon on our Workforce Data Center. And that will also break down the data by industry. Today I'm going to talk broadly about the direct care workforce across the long-term care continuum. So personal care aides, direct support professionals, home health aides, and nursing assistants across all settings. And then I'm going to talk about what we've been up to following our State of Care Home Care Landscape in Wisconsin report. I'll introduce you or reintroduce you to what that report was and what we found, and what we're doing with our recommendations. We're carrying them forward and trying to put those solutions into action on the ground here. And finally, I'll speak briefly about our Wisconsin social media campaign, which carried out in October. So I hope that you saw that in your feeds and liked and shared, and if not, you can always go back and reshare and re-like. So for those of you who aren't familiar with our organization, PHI, we're based in the Bronx, but we're nationally focused. In my role as the data and policy analyst, I'm tracking policy and practice trends in all 50 states, and occasionally taking a deeper dive into a state or a region to assess the landscape there. So that's how we were involved here in Wisconsin, and that was my work here, researching the home care landscape here in Wisconsin. We believe that caring, committed relationships between workers and consumers are really at the heart of quality long-term supports and services. But we can only achieve that strong relationship when workers have a wage that they can live on, training that leaves them supported and confident in their skills, and also when they have greater respect for their very important role in the system. I mean, I know from my meetings with all of you and from following this organization that you share that commitment as well, that really the workers and consumers are really at the heart of the system. Our approach is 3-pronged, so it's rooted in research and analysis, consulting directly with providers and payers and others, and also bringing a strong voice on behalf of this workforce at the local, state, and federal levels. And that approach is informed by over 25 years of experience in collecting original data, in working directly with providers in rural, urban, and national settings, right? So all across the country at every level. And we also have the opportunity to pilot interventions through our New York City affiliate system. So we're affiliated with Cooperative Home Care Associates, which is a worker-owned home care agency that's just 2 floors above us. And then Independence Care System, which is a managed long-term care plan in the New York City area. So now to get us grounded in this topic, I'm just going to talk through the general trends that we're seeing for this workforce. And I know that since you're involved in this group that you already have a deep familiarity with these issues, but just to get us grounded in the topic. Following national trends, so that's gendered work here in Wisconsin. 9 out of 10 direct care workers are women. 1 in 4 are people of color. And 2 in 5 have a high school education or less. And that's a little bit higher in home care, a little bit lower maybe in nursing homes. But generally speaking, that means that we need to be intentional and careful in the ways that we communicate with workers, both verbally and in written form, and especially in training, because many of these workers have struggled in traditional educational settings, and we need to account for that in the way that we're preparing them for this work. Looking at the past 10 years, I know since many of you are providers and you're involved in this space, this is something that you're well aware of, that in the past 10 years here in Wisconsin, the direct care workforce in aggregate has grown by 30,000. But when you look at the distribution of the jobs, that big blue hump at the bottom there, that's personal care aides. So those are the home care workers who are providing that non-medical social assistance, and they've really contributed the most to that growth. And in fact, they've even eaten away at the growth among home health aides, right? So what we're seeing here, as we're seeing across the country, we're shifting services away from residential settings to home and community-based settings. But that's not to say, looking to the future, that these trends will be consistent over time. And I want to talk more about that in just a second. But looking to the future in the next 10 years, 2016 to 2026, we're expected to have over 1,200 new nursing assistants, over 2,200 new home health aides, and over 19,000 new personal care aides. So again, this is based on our existing knowledge about utilization in the past 10 years. We're then projecting that forward. These are from the Bureau of Labor Statistics. But looking even farther down the line, we don't really have a good sense of what demand will be, but we can make some assumptions and generate numbers just to have kind of a rudimentary understanding of what might happen based on current trends. And Dr. Paul Osterman at MIT did just that, right? So in his new book, Who Will Care for Us, he projects that we'll have a shortfall of 11 million family and unpaid caregivers and 355,000 direct care workers. Again, these are assuming that everything stays the same moving into the future, right? So that's why we're all here, because we don't want that to happen, right? We want to take action now so that we're prepared not just for the present, but also for rising demand in the future. So let's talk about rising demand in the future. I put together these two maps for you today. The darkest orange there are counties where people age 65 and older constitute over a quarter of the population. And then down at the other end, that darker teal color, that's a smaller proportion of older adults in the county, right? So we know that this is a statewide problem, but when you look at 2015, you see that the areas where demand is the highest, where the older adult population constitutes the largest segment of the population, these are primarily rural areas, right? The teal areas, these are like your urban and suburban areas, maybe Minneapolis suburbs. But looking to the future, in 2040, this becomes a statewide challenge, right? Where the population of older adults is constituting a huge segment of the population, basically statewide, maybe except for Milwaukee there, but still, that doesn't mean that the providers in those areas aren't going to face challenges. So it's this demographic trend that really brought us to Wisconsin to really focus on rural areas here, because rural areas require special interventions, tailored interventions, and creative and innovative strategies to address the workforce crisis. And in the future, if we can solve our challenges in the rural areas now, that makes us well equipped to address this issue statewide and nationwide. Right? An ongoing challenge, of course, is that we need all of these workers, but these jobs generally don't provide the economic stability that they need. It looks like across all three of the direct care occupations, wages have basically stagnated, but there is a little bit of a jump in inflation-adjusted wages over the past 10 years. So I think that's largely in part to the hard work and advocacy that you're all engaged in here in the state, really fighting for these workers and finding ways to improve their wages. But really, we haven't quite achieved the economic stability that these workers need. That's in part because this is largely part-time work, so that makes it difficult to accrue the earnings that you need to support yourself or your family. But there's another side to this equation too, which is that many workers might be choosing this work because it's flexible. They're working part-time for what we call non-economic reasons. We might think of them as barriers, like maybe they don't have adequate access to childcare or care for their family members or parents themselves, right? But they might be attending school, or they might have limits on their earnings because of retirement benefits. They might be older workers. But that's not to say, so those could be reasons that they need flexible work and want flexible work, but it could also underline the need for a holistic approach to employment supports, being really attentive to what workers need, not just in their work lives, but their personal lives as well. So those low wages combined with the part-time hours, for these workers all across settings, they're earning about $18,000 a year. And again, we can The data will be online soon, and I'll be sure to let you know, but we'll break this down by industry as well. For home care, it tends to be a bit lower. For nursing homes, it tends to be a bit higher. So as a result, 1 in 6 live in poverty, and 2 in 5 rely on some form of public assistance, maybe Medicaid, cash assistance, nutrition assistance, something along those lines. So certainly the economic stability aspect of this is really important, right? We need to make sure that these workers can afford to stay in the field. But even providing workers with a living wage and earnings that they can support their families on won't completely improve recruitment and retention to the extent that we need. We also need to think really holistically about job quality. Think about supervision. Are workers seeing opportunities to advance and grow in this field? Do they feel well prepared in the field? There are lots of ways in which we can think about this. And we identified so these are our 2 reports that we released a year ago. That was the last time I was here to release this report, where we spoke with many of you in this room, and we collected all of the data that we could, and we put it all together into a single narrative of what we're seeing as the home care landscape in Wisconsin, and before that, the home care landscape in Minnesota. And we took that and compiled all the information we had, discussed it with our workforce innovations team, so our consulting arm of the organization, and came up with some recommendations about what we could do to improve job quality. And certainly, wages were a part of that, and reimbursement rates, but there were a litany of other things that we could try as well. So now, a year later, we've partnered with 5 organizations in 2 states, Minnesota and Wisconsin, including Lori Knapp and CLA here in Wisconsin. And we've also been working with cooperative care as well, a little bit on this. But what we're doing is trying to put those recommendations into practice on the ground, evaluating how things go, and using that to learn and innovate and sort of have like an iterative process of workforce development here in the Midwest with a focus on rural areas. Here's the timeline of the project. So you can see we're just beginning to work on this in 2018, so we've already done quite a bit. I'm going to put Katie on the spot in just a little bit to talk about her experience so far. But it's broken down into different elements of job quality. Supervision, so that would be introducing the PHI coaching approach to supervision across the organization. Onboarding and recognition. For these elements, we asked each of our partners to identify one area that they wanted to work on and help them develop a new program to do so. Onboarding was the most popular piece, and one other organization decided to do a new recognition program. They realized that they had a recognition program for some of their staff, but they were leaving out some of their direct care workers, and it was leaving those workers feeling frustrated and unrecognized. So we'll be working on that with them. Next comes peer mentorship. So this is a way in which we can help workers get some new training and advance in the field, but also provide mentorship to new workers so that they're feeling supported when they're entering the field and they have someone to talk to when they need to. Next, we'll move on to entry-level training, which will be competency-based and adult learner-centered. Those are strong beliefs at PHI that we have, and I'll talk more about what that means in practice. And next, we'll be working with each organization to innovate a new tailored advanced role, like based on the needs of each of these organizations, so that we can meet an organizational need, but also a workforce development need, because we'll be working to provide workers with a new opportunity to grow and learn in the field. And finally, we'll evaluate what happened. Collecting data and learning from data is a really important aspect of any workforce development project, so I'll talk about how we'll go about doing that as well. So I'm going to speak about each of these elements in general terms. Like I said, my contributions to this work were primarily in the landscape study. Cian Eppelheimer and Ana Ortigara are really taking the lead on the workforce innovation side. So I've been speaking with them in preparation for this presentation, but I might not be able to answer all of your questions. So I'll also serve as a conduit if there's anything that comes up that I can't answer. So the first component that we're working on is effective supervision. And like I said, at PHI, that means the PHI coaching approach to supervision. It's a relationship-based approach to supervision with strong communication and collaboration, as opposed to traditional supervision, which can be somewhat punitive. I think in our own lives we can reflect on our own careers, and when we think about bad supervisors that we've had, what that felt like as a worker, and we can define what the characteristics were that were really causing us problems. So to draw out what this means in practice, I'll just compare how a traditional supervisor and a coaching supervisor might handle a performance issue on the job, say consistently showing up late. A traditional supervisor will explain the rules and consequences, right? So these are the rules, I don't know what's going on with you, but this is what you need to do. Whereas a coaching supervisor will present the problem, hey, I've noticed that you've been showing up late, offer feedback, that means that so-and-so is going without care for these hours, and they really need to get to school on time, etc. And then gather the worker's perspective. So what's going on? The worker might say, I'm having a lot of trouble with public transportation. I can't get the bus in time. So then to solve the problem, a traditional supervisor would offer solutions and request compliance. These are the rules and you have to follow them or we're going to let you go. Whereas a coaching supervisor problem solves and supports the worker. It's a collaborative process, drawing out action steps on what you need to do or what can you do to solve this performance issue. And both parties agree to it, agree to follow the action steps, and if the worker isn't able to follow the action steps that they've laid out for themselves, then that sparks another conversation, right? Another collaborative and relationship-based conversation. I mentioned that one of the organizations is going to start a new recognition program. I thought it was really serendipitous that we talked about the Caregiver Award Program, because I think the award programs that you guys have in the state, I got to attend the WIPSA Awards last year, and it's really just so meaningful, not just for the caregivers who receive the awards, but for everyone else in the field, right? Because they see that they're recognized and valued for the important work that they're doing. And it's public, right? We get to see who's winning these awards and who's really doing exceptional work in the field. We also find that effective recognition is really specific. I was in Arizona recently, and I was chatting with an assisted living organization, and they have a card system where if one employee sees another one doing something really wonderful for one of their residents, they can write it down on a card, they pass it along to the executive director. The executive director makes sure to acknowledge that great thing that the person did. And then those cards are pinned to a board so that everyone can see all of the great work that everyone's doing, right? And it's also peer-to-peer, right? So giving peers the opportunity to recognize each other is another really effective strategy that we've found. I also mentioned that some organizations were focusing on the onboarding process. So this is the process of interviewing, orientation, getting organizational buy-in. In interviews, I've often seen, in job postings at least, and sometimes this is manifest in interviews as well, in the midst of a crisis, we can go into this panic hiring mode where our advertisements are really about now hiring all shifts, and your mission isn't there, and your values aren't there. And that can come across in an interview as well. If you're interviewing primarily around when can you start, when are you available, and you're not asking them about their personal experiences, that might raise red flags for them, right? So here's an example of a values-based interview question. Tell me about a meaningful relationship you've had with an older person and how that relationship has impacted you. So we're asking them what their experiences are with an older adult or a person with disabilities, and how they comport themselves. Is it a family member? Do they have experience in family caregiving? These are important things to know as we're bringing someone into our organizations. And in an orientation, in the front office, we might feel really tied to our organizations and our missions, but for workers, especially in home care, who might be working independently in the field, making sure that they share those values and are bought into that mission, and that they know that they're contributing to something greater, something societal and community-based is really important. Peer support will also be a part of this project, right? So in peer support, this is really a programmatic element, and we're very intentional about it. Here's an example from Cooperative Home Care Associates. This is an incoming class of peer mentors. They're receiving some additional training in communication, how to speak to someone on the phone in a way that's compassionate and helpful. So then when they become peer mentors and they're having weekly or bi-weekly check-ins with new workers, they know how to hear them and make them and really assist them and support them as they're entering this field. And we know from our evaluations of this model that not only is this helpful for mentees who are coming into the field and getting that additional support, but it's also helpful for mentors who are being recognized for the months or years of experience they have in strong communication, relationship building. It's recognizing that those are really foundational and needed skills for this work, and that we value them as an organization. The next phase of this project will focus on entry-level training. And I mentioned that the elements that we focus on are that it's competency-based and that it's adult learner-centered. So by competency-based, what I'm talking about is not just introducing new knowledge through training, but also making sure that workers understand how to actually apply that knowledge, really hone their skills. And not just that, but also maintain the right attitudes in the field, attitudes that are person-centered, caring and compassionate. And that really, that approach to training is really, it's brought to life by adult learner-centered teaching methods. These methods of instruction emphasize that workers are coming into the classroom having extensive lived experiences, right? And they might also have struggled in the traditional education system. So what the adult learner-centered approach emphasizes is elevating workers' existing experiences through things like group work or journals, pair work, so that we're bringing in their experiences from outside of the classroom and then building on them with new experiences inside of the classroom. So it's very hands-on. You can see in this picture some workers, these are home care workers who are about to practice using a Hoyer lift. And after this instructor demonstrates how to do it correctly, they'll break off into groups of 3. We call them practice triads, where one person is performing the lift, one person is taking the role of the consumer, and one person is observing. So not only does that give them a chance to try this task in a hands-on way, but it also gives them an opportunity to experience the task as a consumer would, so that we're promoting person-centered practices. The instructor, while all of this is happening, will have the opportunity to observe how workers comport themselves with consumers and provide feedback on how they can better communicate, how they can deliver services in a more person-centered way. You know, this is a training lab at Cooperative Home Care Associates. I understand that not every organization is going to be able to have this level of hands-on experience, but the principles apply in not just the technical skills like lifts and transfers, but also in foundational skills like communication and relationship building, problem solving, person-centered care. The next phase will focus on opportunities for advancement. So now we're getting way down the timeline for this project. Like I said, it's 3 years, and now we're getting into the 3rd year, I believe. But there are a number of ways in which we can innovate new opportunities for advancement for this workforce. It might be helpful in these entry-level training sessions to have a worker advance into an assistant training or a training assistant role, where they're assisting the trainer as they're providing an entry-level or ongoing training to existing workers. But in this way, they can bring their experiences from out in the field into the training classroom. And that's helpful for workers as well, to hear it straight from someone who's done this work before. There are a number of ways in which we can innovate specialty or advanced roles around transitions in care, for example. We piloted a project in New York where we provided workers with some additional training, and they were going into people's homes and assisting when people were coming out of the hospital to make sure everyone was on the same page with the care plan, etc. We were able to generate some promising results. We reduced hospitalizations or emergency room usage by about 11%. But when the workers would go into the home to talk about transitions in care, they were finding all these other issues, conflicts with family members. One specific issue, I sat in on one of the focus groups, was an advanced aide came into the home, and they heard that the consumer was consistently falling. They were being hospitalized for falls once a month, say. And when they talked it through with the worker and the consumer, they found out that the woman had 3 little dogs that she really loved. And when she would get up in the morning, they would start running around her feet and trip her up. So it's just a really simple fix of putting a gate in front of her bedroom door to keep the dogs from running in when she woke up in the morning. And they were actually able to prevent hospitalizations that way, right? She still got to keep the dogs and have the pets that she loved, but just like marginally improving the safety in her home really helped. There are tons of stories like that came out of this project, and it just really emphasizes the ways in which workers can support each other through new opportunities to advance and improve the quality of life and quality of care for the people who they're assisting. So finally, we'll be evaluating all of these different elements. I worked with Kezia Scales, rather I should say Kezia asked for a little bit of help on it. This was really Kezia's project. She's our director of policy research. She developed this really excellent survey based on some of our past surveys and really tuned it up. And it's a survey that we've administered to the workers who are participating in this project as sort of like a baseline measurement. We've already done that. We've sent out the survey and gathered responses. After the program has run its course, we'll administer the survey again. What we're trying to do with the social media campaign is to raise awareness about the problems that home care workers are facing throughout Wisconsin, but also the solutions. So it's on one hand, it's to elevate the challenges that I know we're all facing, but also to give us some hope, right? To say these challenges are surmountable and here's what we're doing about it. And we also want to build a base of online supporters who are invested in strengthening the direct care job, really raising awareness of this issue and getting people bought into it. The audiences that we're aiming to reach are consumers, providers, policymakers, and a concerned public. So a concerned public are people who might express interest in these issues, but might not be aware of issues in the direct care workforce yet. Our strategy is to use paid social media to really target people who are interested in aging, elder care, rural Wisconsin, home care generally, or people who are employed in related sectors. We've got a wizard who does our social media targeting for us, and she's able to really capture these audiences and figure out how we can reach them. And we'll also work with local partners to further propagate this content. So that's in part why I'm here today. If you can go onto our feeds, and if you'd like to share or like them, that would be helpful as well. The time frame, we released 1 to 2 pieces of content per week over October 2018. So that's entirely Wisconsin focused. We've now moved on to Minnesota, so now we have a campaign going that's very similar for folks in Minnesota. The key frames and messages. So there are 4 key frames and then a 5th that's related to them as well. The first is to identify the problem, right? It's the home care shortage in Wisconsin getting more severe, right? Something we're all well aware of. And the content, we're presenting data on older adults, on the care gap, on a home care worker job quality, and we're primarily drawing that from our State of Care report, the Wisconsin report that we released last year. So here's a little GIF. We'll see if it works. It's working just fine. That's great. That's kind of a question mark for me. We're presenting basically the basic elements of job quality for these workers, right? We find that engagement tends to be higher on short little videos and animations like this. And we're accompanying that with some text that explains what we're talking about. And we've introduced this hashtag HomeCareWisconsin, so that we can kind of track engagement around this campaign. The second part of the problem we introduce, the challenges facing home care are really much worse in rural areas. So we're really delving into the rural aspect of this work. And the content, again, it's going to be the same sort of data. We'll be drawing that from the State of Care report. So here's an example. You can see that the graphic is kind of designed to fit well on a mobile phone, something that someone can scroll through on Twitter. And here we're talking about the shrinking pool of the labor force in rural areas, the relocation of younger people to urban areas, and just the remoteness of rural areas, the challenges in delivering quality care in over long distances. And here again, we're explaining what we're doing with the graphic and again, using the same hashtag. And then we pivot to solutions. We're talking about how we can improve and transform home care jobs in rural areas. We're talking about elevating the role of the aid, multi-pronged approaches, rural solutions, basically everything that we talked about today, right? Everything that we're trying to do here in Wisconsin. And again, that will be drawn from the State of Care report based on the recommendations at the end, but also on the work that we're doing here in the state. So here's an example on advanced roles. You can see there's the worker in the center there. They can choose between mentoring newly hired aides, assisting in training, supporting clients with complex conditions, maybe through an advanced specialty training, and maximizing communication across the care team. So that was sort of like the example that I gave about the aides who are helping in transitions in care. And again, using the same hashtag and kind of explaining what we're doing there. And finally, we're giving a call to action, right? We're talking about what we're doing here in the state with our partners at LORINAP and CLA around these issues. And you can see this basically maps with what we were just talking about, the timeline of this project, but really elevating these organizations for their participation in the program and really giving people hope that we're actually trying to do something about this, about the rural home care crisis. And finally, we're presenting stories from the workers themselves. Something that we've noticed at VHI, and I'm sure that many of you have noticed, is that the media narrative around this workforce, aside from the crisis that we're facing, largely focuses on abuse and neglect cases, right? The vilification of these workers, when we know from our experience in this field, the vast majority of these workers are doing amazing work every day and really strengthening the communities in a way that we really need. So with this piece, we're drawing from worker experiences in the field. Here's an example from Lynn Jenkins at LORINAP. And this is the quote that I should note that both LORINAP and CLA were very helpful in gathering these stories for us and identifying people, taking the photos. So here's Lynn Jenkins. The impact of being a caregiver was not immediate for me. After about a month, I got it. If you're new to caregiving, give yourself a chance to understand and feel the difference you can make in another person's life and the difference they can make in yours. So, I mean, it's really meaningful, but I think there are some subtleties here that are really important as well. One is that to stick with it, right? That this can be really rewarding work if you stick with it and really develop those strong relationships. The second is that it's not just impactful in the other person's life, it's impactful in your own life, right? It's really fulfilling work. And here's another example from Sam here at CLA. He said that caring for others means so much more than what I do. It gives others independence and choice. They're able to make an impact on our community because of what I do. So again, emphasizing that it's really meaningful work for him. But it's also, I think, one subtlety, and I don't know if this was intentional, but it's elevating the role of a man as a caregiver, right? This is something that we're all going to do at some point in our lives, and men are well suited for this work as well. I mentioned earlier that 9 out of 10 direct care workers, including home care workers, are women. But that means that we're missing out on half of the whole labor force, right? If we can bring more men into this workforce and sort of destigmatize the men as caregivers, then that could improve recruitment and retention. So with that, I'd just like to close out and mention again, I know that all of you guys are aware of the 60 Caregiver Issues campaign, and if you're not, I encourage you to go to our website, check it out. We've got lots of great resources. I went back and checked the Wisconsin Landscape Study, which we released the last time I was here, was issue 17. Yesterday, we released issue 56, so we're just 4 away from 60 issues. So lots of resources. I can't even believe that we made it this far, Yeah, so the most recent issue, I did an inventory of state-sponsored training curricula. Even if that's not something you want to explore here in Wisconsin, it still goes really in deep on what a competency-based, adult learner-centered approach looks like, so you might find it interesting. We also released a webinar on rural home care solutions, sort of drawing comparisons between workers in rural and suburban and urban areas, and also, again, kind of talking through the solutions that we're trying here. So with that, this is my contact information. I don't know if you can read it in the back, but my email is scampbell@phinational.org. You can connect with me on Twitter or LinkedIn. But with that, I'd like to open the floor for questions, comments, responses. We've got a small group here, so we can have this as sort of like a discussion if you'd like.
I'd like to hear from Laura
Oh, yeah.
and their experiences.
Yeah, maybe I'll turn the floor over to Katie, because I know that you've been participating in a lot of this. How has your experience been so far?
So I was just sharing, with Carrie, when she got here, that it's been phenomenal dealing with PHI. So, and I also shared with Stephen too, in the beginning when we met with him and then we didn't really know where this is going or if we'd be asked to be in a partnership with them. Then I was told, yeah, we've decided we're going to move forward. And the first thought that came to my mind was how much work is this? But I can tell you that thought has not crossed my mind since. So I've personally gone through the coaching and supervision training that they offered and then the train the trainer. So now a group of us at Lori Knapp are trained to be able to do the coaching and supervision training with some of our key leadership and then anyone new coming in. It's a culture change is what I'm seeing that this is going to happen when we're using and implementing this training, is that only just a couple of us can't go through the training. We really need to get everybody on speaking the same language, and that when Stephen was talking about how traditional supervisors are, here's the rules, here are the consequences for breaking those rules. Every one of us, I think, has dealt with that in our careers. So to implement that change, to really having the belief in caregivers that they're here for a reason and we need them here. So if you have belief in them, you should really be working with them. If you don't have belief, why do you hire them anyways, and why are they still working with you if you don't even have an ounce of belief that they can do the job? The timelines of the different things that we're implementing have been great. So it is a lot of work, and we've taken a deep dive into it, but the timelines are working with all of our schedules, and it's slowly rolling this out so it's not so overwhelming, and so that the change that's being implemented isn't too much for us to handle. We're actually focusing on our onboarding. That's the route that we chose to go, because we truly believe that it's important when a caregiver starts their first 60, 90 days that they know that they're appreciated, that they see our culture, that they understand our culture, and hopefully that'll keep them, we can retain them through that process. So that's being rolled out right now. I'm actually doing a focus group on Friday, so with some of our, I think we have about 8 supportive home care staff, caregivers that are coming in to do this focus group to help with their onboarding process, to see what they're looking for, what did they remember from when they started, what were their first impressions and things like that. So we're at the onboarding stage right now, so we're very excited to see what it looks like in the future. But we do have some leaders in our organization that are managers and don't really have the leadership there, so really focusing to help them get the skills that they need to be able to be good leaders and to support caregivers that we have. So it's been great. I've never ever talked about a training like this before. We're all adults and we've gone through trainings. We're like, what time is it? I need to get out. I never once think of that when we're working with PHI and CN and Anna have been great. So yeah, it's been a great experience so far.
Yeah, I was sharing with Katie before this that we actually went through the coaching communication training as an organization, and it was conducted by CN and Anna, and I had the same experience. It was so fun. Like, they're just phenomenal presenters. And I think you raised a good point that I didn't mention, but none of this is one size fits all. All of it takes a lot of work, right? Every day in self-reflection, but also organizational reflection. But it also takes, you mentioned the focus groups. A lot of these interventions are deeply informed by speaking directly with people from all levels of the organization. And I think that's a really important element that you brought up. Yes, go ahead.
How do we get signed up?
Yeah, sure. Yeah, we can talk about it. I mean, it's like, we're, as an organization, we want to partner and help. And
Even just to get the resources,
Yeah.
or, to know what they're all working with would be very helpful for all of us. So, your timeline is so long, and then the study at the end, okay, but we need the help now.
Right.
So it
Yeah.
would be great if we could share some of that.
Yeah, I'm sure that so the 10 steps give sort of a general overview and the principles. And I think that we've got some other paper that I can share, just kind of resources that would be helpful in thinking these things through. They might be a little bit older, but the content, I think, is still really strong. So I'll talk it over with Anna and Cian and the other folks, and we'll be in touch. And Todd, I also want to give you
I can sort of echo everything that you've shared. Just recently, we went through a week-long training, actually, and I met people on the last day, and instead of being brain dead and drained, they were excited, and people were like, "Oh my God, I can't believe we just sat through this for an entire week, and I just feel so energized." And I also went through the coaching and supervision training, and can't say enough about Cian and Anna, who are just amazing, very insightful, bring a lot of skill. We're excited to, we also started another initiative in becoming a trauma-informed care organization this year. And so many of the principles of what we're learning are very applicable, especially around supervision and just changing the whole conversation with our workforce, recognizing that life happens for everyone. And there are a lot of backstories. And through our trauma-informed care lens of awareness, we're looking at changing how we approach our clients, and that what's wrong with them to what's happened to them. And for our workforce to train them on the principles of trauma-informed care, as well as looking at all that we can import through the PHI training. We just feel so incredibly optimistic, because we feel that both of these initiatives are kind of a raft, a lifesaver, so to speak. As we were drowning, we feel like we have something to hold on to, and we're really excited to see where it will lead us, and really support our workforce, because I think that what they encounter in homes without support, what they need to know is that they have people behind them, and that they're not alone, and that we're here to really support them through training and through better understanding, because at the end of the day, it really is about relationship building. And as you know, relationships are wonderful, but they're also challenging, and so we want to give people the skills, because what we hear so often from both our clients is how much their worker means to them, and what we hear from our workforce is how much they love their clients. So we just need to make it work and get out of the way.
One of the biggest things too that I've learned, because obviously we go through this and then I'm not there watching over the people that have gone through the training to see if they're implementing it. So we started collecting stories from some of our supervisors that had gone through the training, like how have you used the coaching and supervision, and the growth that I've seen in some of our managers that are they're younger, and they're not immature, but they're not mature in their career just yet. But the growth that I've seen through the stories that they're saying about the relationships they're building with their staff is just phenomenal too, to see that all play out and to get those stories. So the last thing I guess I'll really bring up with it is when we first started going through this, I was guilty of this too, thinking, well, yeah, we can have belief, but you still have to hold them accountable, right? It's not about not holding staff accountable to mistakes that they make, or if they're late, attendance policies. You can still hold them accountable to things, but also show them that you have the belief that they can do the job. So putting that faith and supporting them in that way, but then also they know they have to be held accountable to certain standards too. So it's not just about giving them everything they want, it's about helping them understand the importance of what they do. So, yeah.
That's very well said. Thanks.
I waited, sorry.
No, that's great. I also wanted to mention that part of the reason why these trainings are so energizing and so fun is that we apply adult learner-centered principles there as well, right? So the cycle that we use to train our own organizations, the organizations that we work with, it's the same cycle and the same principles that we would apply to the training and supporting workers and in entry-level or incumbent training as well. Yeah. Any other questions or comments?
Where did this training occur? Is it
Comes on site.
It is, yeah.
Okay.
Yeah. So it includes, so it's informed by an organizational assessment.
Okay.
So we do focus groups and speak directly with people, and all that sort of comes into the classroom as well. Yeah.
Is there a class?
There is, yeah, yeah. But we can talk about it. I mean, we have resources to share as well. There's more that we can share about this. I don't want to make it seem like this is like a exclusive program, because it's absolutely not.
So was I. Oh.
Food away, it's fine.
So I am reflecting back on what I've heard, and I understand that research and advocacy is also part of what you do. So some of the things that I find to be very alarming is it feels that the caregiver role creates a whole other a population of poverty. That if we continue down this road, we'll continue to need to be supported, maybe by family care or the Irish labor, by Medicaid dollars in the future as aging. I find that to be alarming because we're not fixing any problem, we're creating more struggles for our own selves with the folks that we're trying to support. Does that make sense? So I'm wondering two things. One, when you're looking at that, are you looking at public policy and how some of the things that we need to address at the state level, and what some of those trends are? Because I'd like to hear your feedback on that. And two, another thing that I've also noticed as a trend, now I'm going to speak only for Dane County or Madison, I don't know what the rest of the state has done, but working with some of the folks, or talking with some of the folks within Madison, there's a large workforce that we are unable to tap into for fear of deportation. Have you included that into your study? And so I'm wondering also, what are your strategies to work around that as well? So that's two questions.
Yeah, those are great questions too. So I'll start with the first one. And to paraphrase, just to make sure that I understand correctly, the concern is that I guess say more about that. Do you mean that by making services more available, we're sort of experiencing a woodwork effect where?
No, I don't know.
Are you saying that the poorest people in our country are people with disabilities and the next poorest people are the people with caregivers?
Pretty much. I mean, like in a good way. So I think I saw, was it 1 in 6 or 2 in 5? I can't remember. I flipped my screen off, unfortunately.
Use public, maybe it's 2 in 5.
Which I don't,
public,
and I'm
yes.
not criminalizing that. That's not what I mean to say. But I'm saying that what we're doing is we're taking a group of people, keeping them in poverty, and I'm wondering how we can stop this, because we have to stop that.
Right. Well, I mean, there are a litany of ways that we can do that. I mean, we're talking primarily about compensation then, right? And I think that a challenge that I hear frequently in the field, and in Wisconsin included, that public benefits can sometimes create sort of a cage, right? Where if you increase compensation in hours to a certain amount, the individual is going to fall off a cliff,
Yeah.
Kind of
right?
like a donut.
Where they lose all of the benefits that they need to support themselves, but then
they don't have enough.
we don't have enough, right? Exactly. And I think that I'm not sure that I have, there's no one-size-fits-all solution in this field, especially when it comes to complex issues around reimbursement and financing and how those relate to wages. But certainly addressing wages is absolutely necessary, right? And we see the wage charts.
Trying to do.
Right,
Yeah.
right. And opportunities for advancement as well. Adding new rungs on the ladder can be a really helpful way to help people achieve self-actualization in this field, but also achieve a higher level of economic stability right, if we attach wage increases along the line as well. And I know that that comes back to reimbursement as well, right? It's all sort of part of the same ecosystem. But it,
Education level, I mean, like,
Yes.
we have that too, so it's,
yeah. So
I don't know.
I do want to note, though, with the advanced role that we piloted in New York, there was one of the aides, Marisol Rivera. She was a home care worker for a long, long time. She started this training. She got the wage increase. But really, for her, it was participating in the training, being totally terrified of all of these new responsibilities, as all of these aides were, right? Because we were adding on a lot of new responsibility. But by the end of it, and after they're actually making an impact in the field and applying the skills that they didn't even realize that they had, by the end of it, she said, well, maybe I could go on and do a nursing degree. Not to say that that's the only career path, but to suggest that adding more rungs on the ladder can help people advance in the field in whatever direction they want to head in, right? And there was a second part to that question.
that makes sense. My brain's already thinking that this could be like, if we started getting people to think of it differently, that this could be a feeder job, I mean, for lack of a better term. Because I started doing this in college, but I went to college, so if we start somewhere and say, but you can, it's not, you're not stuck.
Yeah, it'd be nice if they stayed with us, but at least you're giving them the tools to grow, and then they're still in the field, even if they're somewhere else with it.
Yeah. And the second part was, thank you. The populations that are struggling to tap into, the target around workforce, right? In the Dane County, I don't know if other counties, but in this one.
Sure. So, I mean, I think a lot of the workers in a really tight labor market, like you have in Wisconsin, and it's only going to get tighter, right? We know that from the new Foxconn plant, the Amazon distribution center, whatever, insert whatever competitor. Here in Wisconsin, it's Quick Trip, right? Everyone's talking about Quick Trips. In Buffalo, it's Tim Hortons. Like, every city has their like home care villain, right?
Yeah.
Which is actually just an organization that provides a decent job, right? With opportunities for advancement, et cetera. So the people who are primarily entering this field now, it depends on the space and the area. Lots of different reasons bring people into this field, perhaps family caregiving obligations, et cetera. But some of them have maybe been disconnected from the labor force for a long time, and they need additional on-the-job supports, both in terms of communication, but also in terms of social supports. Is there a network of social supports that we can tap into to make sure that we can address their barriers in their personal lives? Whether that's a disconnected worker or whether that's a recent immigrant, each of these workers might be facing unique barriers. So being attentive to their needs and simultaneously thinking creatively about how we can link together social services that are already out there such that we can reduce their barriers in their personal lives so that they're happier, less stressed, and more able to be present on the job. I think that's the direction we ought to be moving in. Because we can't do it all ourselves, right? We can't undo the decades of struggle that some of these workers are facing. But we can perhaps connect them with resources in the community that already exist if they're out there. I think that's the movement we've seen in other parts of the country at least.